So today we're checking in with, well, I'm gonna just have you introduce yourself. What's your name and what do you do?
Sure. My name is Mike Weber. I'm two things really. I'm the public health director, and in that role, I work under the Josephine County Commissioners, and I fulfill the role of managing the Office of Public Health.
Okay.
Aside from that, I'm also the public health administrator, which in some counties are two separate roles. And in that role, I work for the state of Oregon. I work under the Oregon Health Authority as a state officer, and I'm responsible for executing the guidelines and mandates of the state. So I sort of wear two hats.
Okay. A lot of pastors and office managers and whatnot of churches who are watching this are going to understand the wearing many hats. How long have you been doing these jobs, plural?
So I've been here about 2.5 years.
Uh-huh. Cool. Well, so what I did is I put out into our email list if any pastors have questions that they want me to ask you, kind of while I have you on the line here. A number of us participated in the webinar a couple weeks ago at the governor's office, and I'm sure there's some good reasons for it, but a lot of us felt like it's, there's some things that we are hoping some clarity on, and it ended up not being that helpful. So I thought, well, let's some things have happened since that webinar, but also you're more local, and we value local relationships and hearing from our local leadership. And so so I have some questions from some of these pastors to ask you and see if we can, if you're able to provide any clarity that maybe they didn't have time to do on that webinar, or hasn't been, I guess, expressed as clear as maybe we wished. So one of the things that we, the Church of the Valley leadership has recommended to our local churches is to create and submit a mitigation or a reopening plan to you and to the Board of County Commissioners. We wanted them to do that. We want to do this not only for ourselves so that we can be intentional about our reopening process, but also as an act of transparency to our community, and to work in partnership with our local leadership. So first of all, remind me, are submitting these plans, I mean, I'm sure that you think that's a good thing, but is this a mandatory thing that churches should be working on?
Oh, absolutely not.
Okay.
So this actually goes to something that we're offering to any business or organization or group in the community right now. We're offering our time and our service and our expertise to review plans and guidelines and policies that different organizations are pulling together. And we're not trying to give you permission one way or another. We're not trying to deny one way or another your right or your ability to reopen. What we want to do is we want to provide our expertise so that we can say, when you do, here's how you can do it well, here's how you can do it safe, and here's how you keep yourselves, your staff, and your constituents safe. So it's something that I've done with restaurants and woodworking businesses and a number of other different organizations in the community.
Okay, so is that what we recommended was when they have this plan put together to email it to you and to the Board of County Commissioners. Is that appropriate, or would you recommend, is that the right kind of work step for us to take?
I think there's nothing objectionable about it. Ultimately, it'll be myself. And so we have 3 staff really that are doing reviews. We have somebody who they are actually a former OSHA inspector and safety officer for organizations. So we have that safety officer component. We have our health officer and myself, and we're the ones that are reviewing these plans and providing feedback.
Okay. So once we submit those plans, there's a couple of churches who have submitted the plans, and they said, hey, ask them like if there's a timeline or what comes next, or are you going to, if we don't hear anything, does that mean that like we're good, or are we going to hear back? Like what's the process if a church has submitted those plans to you? What happens on your end? What happens next for us?
So one, I'll ask for a little bit of patience.
Yeah.
I think a couple people, I think I may have conflated a couple of the people in your community. I thought that we had met with a couple of them last Friday, and I've since been told by one of my staff that, no, we've actually been receiving emails. They're still asking questions. So we will get back to everybody. We're expecting to get back early next week. We were hoping to do it today, but we weren't able to pull it together. We got more than we expected. So not just from religious organizations, but others. But I think I have 7 different churches plans right now that I have staff looking over.
Okay, and today is May 22nd, so you're hoping that next week you can kind of get to those. Do you plan, like, if it's a good, you're not going to contact, or are you gonna be like contacting
we'll
each?
contact.
Okay.
We'll contact regardless, if for no other reason than to say that, because we know that people are looking for affirmation of the good work that they're doing, and you know, most are looking for honest feedback of what they can be doing better as well.
Okay. Are there anything that, I mean, I'm sure you've done some cursory glances over things. Is there anything that's standing out of things that you're glad to see, fill in the blank, you're concerned about, fill in the blank? Here's some common thoughts that kind of come to mind as you're glancing over some of these plans.
So some of them provided maps and layouts of their facilities. That's really nice. Because a lot of times when we work with an organization, we like to go in and actually put eyes so that we can see what does ingress and egress look like, where are people coming in, where are they going out, you know, if food is being consumed, where is it being consumed. So having that layout really helps us picture it in our mind's eye. The other thing is specifics are really nice. Some plans we'll see a very generic, we're going to ask people to stay apart, and are you enforcing that in any way? Are you requiring it? Are you simply asking and then closing your eyes really tight, hoping that happens? And you know, it's more obvious for us that there's been some real thought put into it if people put some specific guidelines, specific things that they want to do. So probably the big one is any serving of food, whether that be general food or whether that be communion or something else. We've seen plans that suggest that, I believe one of them said that we're going to ask people to bring their own communion. Another one said we're going to put communion out ahead of time. And I think another one said, well, we're going to have a person handing out communion, but here's how they're going to be protected and PPE, and here's how they're going to be separated. So part of it is just seeing some actual, true, critical thought put into it. I think, you know, there's a range of how people are responding to this incident. Some people are very concerned and maybe overcorrecting in terms of the safety measures that they're putting in place, and other people are on the opposite end of the spectrum. And what we're looking for is reasonable accommodations, reasonable solutions to the problems that we're facing. But I think most people recognize that no one will benefit. No organization is going to benefit if ultimately they wind up being the center of an outbreak. We're sitting in a really good position in this community. We haven't had a new case. I believe we're coming up on 16 days. And all of our active cases have currently closed out, so we don't have any active cases at present. We're sitting in a really good position, and I think that we're well situated with all the protections we have in place to start opening up. But it would only take a couple missteps for us to stagger back. Nobody wants to be the center of that.
So what I'm hearing you say is, if we have put thought into the specifics, it can be helpful in our, you know, it can be helpful to put them on the paper that we're doing for ourselves, and then also to communicate that to you. That just helps you have a good, if we're seeking your guidance, if we're seeking your services to look over that's going to help best communicate to you. I mean, yeah. So details are good, are helpful.
Yeah, I mean, we aren't a box to be checked, right? You don't have to go through us. There's no requirement to work with us. So if you are, what I want to know is, are you truly looking for some meaningful feedback from us? Do you
Mm-hmm.
honestly want it, or are you doing it as a mechanism to cover yourself?
Mm-hmm.
If you think it's going to provide some form of protection, and that's not what we're here for. If you want that, call OSHA. OSHA will come in, they'll do an inspection of your facility, they'll do that detailed review, and they'll give you that form that says, hey, I had OSHA come in and look at my plans and look at my facility.
Does having to look at it cover us in any way? I mean, is
No,
it practical for us to think of this as a box to check, or is that maybe just it has no real meaningful value to it?
I don't know that that's a worthwhile way to look at it,
Yeah.
because ultimately, if you're coming to us, my hope is that you're doing it because you want to make sure that the plans you have in place are good, and that you have effective means to keep you and your people safe.
Mm-hmm.
And if you're coming to us for a different reason, if you're coming to us because you just want to check the box and be done with it, and I've had a business do that. They sent a plan, and it was literally a copy and paste that they took off of a state plan. They didn't even change their name on the form.
Mm-hmm.
And you obviously haven't read this.
Mm-hmm.
If you haven't read it, then you obviously don't care. And
Mm-hmm.
if you don't care, then anything we tell you isn't going to matter. So honestly, if you come to us, we're here to help. We're here to provide a level of expertise that a lot of folks don't have access to. And, I will happily dedicate my safety officer's time. I'll happily dedicate my physician's time. We have a physician advisory group. If it means that people are honestly looking for honest feedback.
Okay.
That's what we're here for.
Yeah, that makes sense. So you mentioned you kind of touched on this. I was going to ask, we're in phase 1 right now, and from your perspective, how's it looking? You kind of touched on that. Is there anything else you want to elaborate on, kind of what phase 1 is looking like and feeling like here in Josephine County?
I can tell you the town's starting to feel a little bit more alive.
Yeah.
We're seeing a lot more people out, and the excuse me, allergies, I promise. So I think it's a really positive thing, because people need that social interaction. They need that social touch, even if it's not physically touching.
Sure.
The other thing is we're starting to see social services themselves become more available, whether it be community corrections starting to offer support for inmates integrating back into communities, whether it be UCAN or other nonprofit organizations being able to step up and become more engaged. All of these things are a benefit for our community in normal times, and they're especially a benefit for us now.
Mm-hmm.
And the fact that we're able to start to provide these things without, at this point, seeing a spike in our COVID-19 cases it's a good sign. We're actually cautiously optimistic, which is sort of a constant state for us in normal times.
Yeah. Now, when we get to phase 2, and we hope phase 2 is able to seamlessly follow phase 1, can you help us understand what will change for churches? What are some details that will change for churches for phase 2?
I would love to answer that for you.
Okay.
We're just starting to get some of the guidelines outlined for what we have to do to enter phase 2. We're still waiting for more specifics in terms of what phase 2 is going to mean for the community. We're really hoping next week we see some actual specifics. Phase 1, we're getting changes right up until phase 1 rolled out. And I can kind of forgive that, right, from the state. There was a lot to pull together, and there was a lot of subject matter experts' opinions to integrate into the process. We don't want to see a repeat of that. If we don't have really firm guidelines for phase 2 outlined by next week, it's going to be problematic, because we won't be able to provide anything to you.
Mm-hmm.
So we're really hopeful, though. The state's promising us that we'll be getting something soon.
Mm-hmm. So there's not really, I thought I saw somewhere, and before we got on here, I just wanted to refresh my memory on what details there are. I just did a Google search, and it wasn't obvious where I could find those details, but I seem to remember gatherings up to 100 people with the social distancing are allowed in one place. Does that ring a bell, or I mean, I thought I read that somewhere on Kate Brown's.
So I've seen a number of different population counts proposed. I think 100 is the last thing I saw.
Mm-hmm.
However, I don't know that that's been finalized.
Okay.
And that's sort of the weird state that we're always in public health. That there will be information out there and people will call us and say, hey, can you confirm this? And we'll go, no. It's probably right. I suspect 100 is the most likely count, but that could change. In phase 1, we saw the count change from 10 to 25 just a few days before phase 1 rolled out.
Mm-hmm.
So it isn't that we haven't received some guidance, we just haven't received the final stamp of approval guidance yet.
Yeah. So you're in kind of you're in a difficult position. It sounds like where you don't have details, or maybe you haven't given permission to release the details, and in your role, you can't really give those details if you don't have them.
It's not really about permission. I mean, I certainly could, and I know some other counties that put some information out. What we don't want is for there to be misinformation out there. If we push, 100 and it changes to 150, we're going to have to try and correct it. And a lot of people won't have that information available to them. And it becomes a bit of a mess. There is a definite art to how you communicate with the public and what information you put out when. Our position is generally, we want to wait until we have some much firmer numbers out there. If you go to some state resources, you can find some stuff, but it's all tentative at this point.
Mm-hmm. One of the questions that we had was just noting that in the faith community, we've struggled with what feels like unfair treatment in this in the rolling out of reopening, and it's, we see other indoor facilities where the public congregates daily, and they seem to have different rules or less restrictions or less oversight than churches, which are also indoor facilities where the public can accesses, but not daily, once or twice a week max. Can you help us understand that? Is there it can feel unfair to those of us in the faith community. Yeah.
Well, I'd say there's actually a few different things at play there. In some instances, there are less restrictions, like grocery stores. Other times, some organizations have the same restrictions, they just aren't abiding by it. And we've had to contend with that a couple times already. We don't handle it in public health. We're not an enforcement agency. We're here, we're a support organization. But I know OSHA has had to step in with some organizations that weren't abiding by the guidelines. So in some instances, I think what you may honestly be seeing is just a failure of another organization to do the right thing. Mm-hmm. And at the end of the day, that is certainly an option. I guarantee you, I know for a fact that throughout the state, there's a number of religious organizations and non-religious organizations that have overtly said, we're not going to listen. Mm-hmm. And you could get a fine from OSHA, you may not, but mm-hmm. I guess the question, and this is a very personal question that you have to ask yourselves, is are you doing the right thing?
Mm-hmm. Now, as it concerns, I guess the kind of classic example right now is the liquor stores are open, but the churches aren't, something like that. Is there some level of, what's your understanding behind that? Maybe there's a perspective that we in the faith community don't have that you might be able to share with us, but do you have any understanding about why that decision would be made kind of up at the top?
So I can tell you something that I heard from a state official
okay.
On that exact same question. What they said is that they're both open to the same degree. Now, I know I've heard a response from a church as being, we can't open in the same way that a liquor store can. We have to have more people, or we have, so the state's position and a lot of religious institutions' positions are essentially at odds with one another.
Mm-hmm.
I know that if we had an official from the state, they would say, no, you can open up the same way that a liquor store can.
You mean, help me understand that. You mean as far as before phase 1, a liquor store could not have more than 10 people in at the same time?
And I honestly, I don't know the specifics around.
Mm-hmm.
We haven't had any, we haven't done any plan reviews for a liquor store, at least I haven't, so I'm not up to date on all the guidelines, but I believe what the state person was saying was you can have the same number of people and things like that. That'd be my presumption, at least.
Mm-hmm. And then, like, when we go to Freddy's or Safeway, and there doesn't seem to be a lot of enforcement of anything when I'm, and so again, that sometimes makes me feel that kind of like unfairness, or maybe I can understand how some folks would feel just, this is really unfair. Like, if we opened up right now, we would exceed what's happening here. Anyway, is it just hard to police? I know you're not a policing agency.
So we have, I won't call out any specific organizations just because it's not our role as a community partner. But we have had conversations with a number of organizations about their failure to maintain proper distancing, maintain counts of individuals in their facilities. It's been a problem at a number of places.
Mm-hmm. Okay, so it is a problem that you're aware of, and it's just one of those things where. Very
much so.
I mean, yeah.
I can tell you part of what makes my job difficult oftentimes is what I can't say or what I shouldn't say, and this is definitely one of those times.
Yeah.
I'd love to be able to say, yeah, we've been in contact with that organization, or that place has been a significant issue.
Yeah.
But yeah, it's a conversation that we continue to have.
Yeah. So on some level, they are taking upon themselves to run that same level of risk that perhaps a church would run if we decided to open up against the guidance of the state. So those grocery stores that may not be policing the use of their space, that again, it's kind of running that same level of risk of that could lead to a fine, that could lead to something, or it might lead to nothing, but they're needing to make that decision about are they doing the right thing or not, and kind of think through those issues.
Yeah, and to be fair to the state, because they have addressed this question a number of times, and I do want to reiterate what they've said. Their big concern is prolonged exposure. So that's a legitimate concern. If you pass by somebody on the street, the odds of you contracting COVID-19 are actually very small. Decreases a great deal if you're able to distance, and it decreases some more if you both masked. And so for us, it's about, we try and bring the constraints in, right? Think the small changes we can make to have a big impact on the spread of the disease. So I know one thing that has been commented on by the state is events that have people in close proximity for extended periods of time. So it's not just the proximity, it's also how long. So I know that they've raised concerns about if churches don't socially distance properly, it could be a problem because of how long people sit together.
Okay.
Whereas in a place like a grocery store or a supermarket or a hardware store, it's people pass one another, they aren't actually sitting together.
Yeah, I can see that. I can see the distinction there.
And that's the state's argument, and I just want to pay it justice by at least passing that forward. So
yeah, okay. That was kind of the bulk of the questions and concerns. Are there any questions that you wish I'd asked or information you'd like to share with this audience? And am also aware that just, last couple of hours, the president has declared that churches are essential and has kind of challenged governors to open the churches, to not resist the churches opening back up. So that's kind of an interesting part of the news cycle. And, now what is that going to actually mean here in Oregon? Was the governor going to respond to that? Those are things that I'm sure you can't comment at length on, but that's definitely, in the backdrop of our conversation here too, is as churches are wanting to reopen and submit plans and be thoughtful about those plans, and then there's this kind of this other stuff happening in the news cycle that may or may not impact our decision-making process.
So I had not seen that yet. To be honest, I don't pay a whole lot of attention whether it's something coming out of the federal or the state level until we get written guidance, just because things tend to vary quickly. But I've been in meetings most of the entire day, so I'm sure I'll learn about all of that tonight, like I do.
Yeah. So the president's, kind of made a comment that if governors resisted that, he would override them. And then there's, there's the federal government versus the governors, and the state right versus federal, those kind of dynamics at play. And you're right that until it trickles down to a memo that comes across your desk, or something that is going to, but I don't know. Does that raise any thoughts or hopes, or kind of from your position as looking after the well-being of our county, wanting to kind of help impact the well-being of our county? Does that spark any thoughts or or hopes or recommendations or concerns, or I don't know?
Honestly, not really. Like you said, until we get a policy, there's not a whole lot for me to act on. There's nothing that would change what we do. One of the things I talk about quite often is our role in public health is our ultimate goal. In the vast majority of things we do is to influence behavior, whether it be convincing, increased rates of breastfeeding, or decreased smoking, or healthier eating, or diet, eating, or exercise habits, or all these other things that we do. It's about influencing behavior. So that's sort of how we parse in most of the conversations we have. And when it comes to verbal guidance or political minutia that happens between the governor and the federal level, honestly, it really doesn't have much of an effect on us. Thankfully.
Yeah. Are there any?
Thankfully, I have enough things to worry about.
Yeah, I can appreciate that. Are there any questions that, I should have asked, or some, or any thoughts that you'd like to share that I haven't given you an opportunity to share?
Nothing's really coming to mind. I've been getting a lot of questions about what's happening regarding the court order and the potential suspension of executive orders. And I don't have anything to add to that. That's a conversation that's being handled by the courts, and it may or may not significantly change what we're doing. So we're sort of in a holding pattern for a lot of things right now. We're in a bit of a hurry up and wait stage. We put a lot of protective measures in place for the community, and most of those are just being held until they are or are not needed. So right now, as always, we're asking people to be relatively patient. We will get back to the stack of plans that I have sitting right here for me to review in the next couple working days. And yeah, other than that, if you need anything, don't hesitate to reach out. Please recognize I'm not necessarily going to be the quickest at getting back to you right now. We're a little busy. Yeah,
you mentioned to me in a previous conversation how a lot of counties are just passing these things off directly to OSHA, and we're a county you've chosen to not just pass it off, but to try to provide some more local engagement on these mitigation plans. Is that what I remember correctly?
Well, and I mean, for me, it's for good reason. If we're going to be putting our time in, and people honestly want to get good feedback from us, we're happy to provide it. It's why we're here. It's why we spend taxpayer money, is to be able to provide these services. So
Yeah.
We're happy to.
Now, we, especially as Christians, our community, we take seriously God's invitation to us, and almost even command to us, to bring prayer concerns to God, and to talk about, to the concerns of our neighbors and in our community, and to ask for God to intervene on behalf of our neighbors in our community. And you have a unique role, and I know you're not going to, I'm curious, how should we be praying for our community? And maybe for you, it's more, how is our community hurting in ways that maybe you have a unique way of seeing that would kind of give us some direction for our prayer lives?
So where is our community, particularly in greatest need?
At this time, yeah.
I would say right now there's a lot of conversation around who's struggling, whether it be businesses that are trying to figure out how to stay afloat in this new environment, whether it be individuals who are struggling because they don't have access to the same social supports and the same resources that they need in order to live happy, full lives, to see their well-being cared for. And I think that's actually right on point. We have a lot of folks outside of COVID-19. We are a community that has a lot of people with a lot of need, and that's only accentuated right now. We're seeing that even more so. So those individuals who don't have access to the resources, to the social networks, to the things that keep them safe and well. So I'd say if you're looking to know who needs the help, that's where I'd point.
Thank you. Also, we're in the Christian Bible, we're encouraged to pray for people in high positions, and I think that includes here in Josephine County, directors of public health. And I want to ask, how can we pray for you, or maybe there's how is your family well? How can Christians be praying for Michael Weber?
At the end of the day, I have food on my plate tonight. My family has food on theirs. I have a place to live. We are going to be okay. But there's a lot of people in this community who won't. So I would say focus on help on those who need it.
Mm-hmm. Well, in our Christian world, we would kind of say that a praise report, that's worth, so because of that we're glad for that, and we definitely want things to go well for you. I'd love to close our time with prayer, and I'd love to pray. Is that cool?
You are welcome to. I would never tell you to.
Okay, well, I'm going to pray, and those of you who are watching this, you could just join with me. So, Lord, I want to thank you for this time with Michael Weber. I appreciate the position that he is in, and the concerns that are come across his table, and I ask for you to help give him wisdom and sustenance and creative ways of responding to the different things that come into his world and his job, as he looks after the well-being of Josephine County. And we know that is something that is close to your heart as well. And so I want to ask for that for him, for protection for his family, and just generally, we want to pray for our community and our neighbors and the businesses and the individuals who are in just dire straits. We ask for you to move in our county and in our city, that we would see this place flourish in the midst of COVID-19, and and especially as we move forward, hopefully into a time when COVID-19 is something in our rear view mirror. So I'm thankful for this time. Would you bless and keep Michael and his staff? And we pray this in the name of Jesus. Amen. All right. Well, again, thank you. Appreciate the time that you took. I hope that it was helpful to those who are listening. And maybe if a whole lot of new things come through the news cycle in the ensuing weeks, maybe we can schedule another conversation. So
Absolutely.
thank you.
Thank
Catch you
you.
later.